Good evening, dearly beloved sisters. Good evening, mummies. I want to welcome you to another edition of our Saturday classes. We thank God Almighty for the privilege to see another Saturday. It's always an honor to see the beauty of another day. It is not a right, but a privilege, and we have every reason to thank our Maker. So, you are welcome to class today. Quickly, let me give you a disclaimer. This is Tabitha Health and Wellness Forum. It's a community where we come together to encourage one another, teach and instruct and guide one another on the issues of health and wellness. On this platform or in this community, generally, we do not diagnose any medical conditions. We only teach and educate ourselves on issues that pertain to our health. So, in case you have any medical problems, medical conditions, any medical condition, please do not hesitate to see your practitioner, your physician, or your medical doctor. So, on that note, I'd like us to go into what we have for this month. This month of June has been dedicated to cardiovascular health. We will not have the opportunity to dive deeply into this matter, but we will share information, basic and fundamental information that will help us and guide us right when it comes to cardiovascular health. We are not dealing particularly on diseases, but we are talking about the cardiovascular health, how you can maintain the cardiovascular system. And I trust God that as we listen tonight, where I'll be starting off, we'll be starting the topic. I'm trusting God that the Lord will minister grace into our heart, mix faith with it, and also help us, grant us the grace to be able to pay attention to the instrument that He has given to us so that we can take care of it. And hence, the organs and the instrument will be able to perform what God has given it, what God has created it to perform, which is in totality to help us to fulfill our God-given purpose on earth. So, welcome to class where we'll be talking about cardiovascular health again. Cardiovascular health is such an interesting topic, and it's also one topic that people don't want to listen to. Either they say that it's scary, and then it gives them good goosebumps, and it makes them to think so deeply about their hearts, and then they begin to get so overconscious and become very paranoid. But I don't think it should be in that line. It's okay to feel that way, but I want us to change our approach. The more information you have about a thing, the more you'll be able to appreciate it, you value it. And when you value a thing, and you know the value of a thing, you will not abuse it. And so that's the reason why you need to get enough information about cardiovascular health. A lot of people don't even understand what cardiovascular is. They don't understand how. They just know there's heart. They don't even know. If you ask some people, where is your heart located? They might tell you it's behind their back or by their spine or in their stomach. It will shock you. So it is important from this smallest point to even know where your heart is located. What is cardiovascular health? Is it something of importance? Is it something of great importance that you need to pay attention to? So let us look at it tonight and see if it's something that is really important for us. Anytime you hear the word cardiovascular, cardio, it refers to the heart. Vascular is referred to vessels. So it is heart and vessels. Okay, some people say a cardiovascular health is about the health of the heart. So this is what I want to pass across to us today. That whenever you hear the word cardiovascular, three things should come to your mind. The first one is you must understand that is talking about the heart. The heart. Okay? The heart is that part of the body, that organ that is very crucial. That as long as the heart is still breathing, the man is still alive. Once the heart stops breathing, once the heart stops breathing, then there is no more life. Okay, so it is important. I think on this note, it is something that we should pay attention to because it's a very, very critical organ of the body system. And the way God has created this heart, if you look at the anatomy of the heart, talking about the structure of the heart, you will see how amazing God is. There are some muscles that protect the heart. It is not the same kind of muscle that you can find anywhere. The particular muscles that were used to structure the heart, they are thicker. They are not just narrow or tiny muscles. So it shows you that God is quite intentional in creation. So when He's creating certain things, He made them flexible. He made some organs flexible because they contract and they control open and close. Right. He made some part of the organs. He made them very thick, the walls very thick. He made some walls very light because of their operation. So you can see the wisdom in the God that created us. That is why we all have to pay attention. At least little knowledge of every part of our body system is very critical. So the heart is part of the cardiovascular. And the second thing that you must understand about cardiovascular is this. If you hear cardiovascular, the second one is vessels. There are vessels in operation when it comes to cardiovascular system. The vessels, once the vessels are diseased, then they will create major problems in the cardiovascular. Then the third one is the blood. The blood is another part of the cardiovascular. The blood is what flows in the heart and in the vessels. So you can't separate the blood from the cardiovascular system. In fact, the blood itself is the life of a man. When the blood is diseased, there's going to be a problem in the vessels and there's going to be a problem in the heart. So we've talked about the three major things around the cardiovascular health. So let's talk about the heart. What do we understand by the heart? If you hear the word heart, what do you understand? So let's just look at few things around the heart that makes it such the powerhouse and that makes it the life of every man. The heart is a powerful organ of the body. It's a very powerful organ. It works constantly without ever pausing, without stopping, except when life is gone, except the end of a man. The heart is always pumping blood, always pumping and pumping and pumping and pumping and pumping the essential part, the life of a man, which is the blood. And it doesn't rest. That okay, let me take a break to rest. And the way God created the heart, like I said before, is that God created the muscles, the heart, with a different kind of muscle called cardiac muscle. This is the only place that you can find this kind of muscle. The cardiac muscle can only be found in the heart. You can only say that in the heart because of the contraction, because of the pumping. It's always resting, never. It's always pumping, never resting, and never pausing. That's why God designed it that way. Isn't God awesome? God is awesome. He knows it knows the kind of work, the enormosity of the work that heart is going to be performing on a daily basis. And so he decided from creation and made sure that the kind of muscle that will protect the heart, that will carry the heart, should be a stronger and a more powerful muscle. Another thing that your heart your heart do is this: our heart is able to also take up deoxygenated blood. The oxygenated, it knows that this blood is not oxygenated, and you know that the quality blood that gets into your body, that is affecting your body, is oxygen, oxygenated blood that has oxygen in it. You know what the heart does? The heart now pumps it to the lungs. That's why there's a powerful connection as well between the heart and the lungs. Now, the heart pumps it into the lungs to get it oxygenated before transporting it back to other part of the organs of the body. Another thing that happens in the heart is that the heart also transports waste out of the body system. It takes out waste as well. The heart also transports certain hormones to also part of the body system. There are a lot of work that the heart is doing on a daily basis. As you're sitting there, as you're walking, as you're dancing, whatever you're doing, the heart never stops. The heart never pauses. And so, okay, let me take a break. Always working. If a man lives 100 years on earth, the heart will be pumping for that period of time without pausing. And one thing, the only responsibility that God has given to us is to ensure that we maintain what has been created. I don't think that is too much to ask for. Maintain it, take care of it. And one of the ways to maintain the heart properly is also to be informed adequately. I am trusting God that we'll be able to understand this particular aspect so that we can know the reason why we have certain things happen to us. All of us are immune. All of us are not immune for to have certain issues. But we have been created in such a way that those issues, when they come up, there are certain organs in the body, especially the heart, is able to take up the challenge to ensure that your heart is doing fine, your body is doing fine, your whole life, the blood is also doing fine. The vessels. The vessels are like means of transportation. Let me put it that way. I've described the vessels like the piping system in a body system. No matter how powerful your water source is, your water source can never get to your toilet, can never get to your restroom, your bathroom, any part of the body that you want the water to flow into without a connecting pipe, without different kind of plumbing work or connecting system that will ensure that water gets into every part, every corner that you want your water to get to. The water can get everywhere only if you connect the piping system to that particular place. And that is why we need to take care of our vessels. Our vessels are equally important. Your vessels must be free. Imagine if your vessels are clogged up. That means that there's a problem. It's going to be a problem automatically in the entire system of the body. Because these vessels, they go everywhere in your body system. And because they go everywhere in your body system, you are sure that you want to ensure that there's no clogging, there's no blockage in any part of the vessels. Now, the blood. The blood is the life of a man. The blood is important, very, very important. The heart cannot operate without the blood. Neither does the blood operate without the heart. They are all connected together. When the heart is faulty, that is when you see all kinds of things begin to happen to a man. Because the heart is the critical part for the blood supply, for everything. The blood, your heart is the one that carries, that ensures that you have oxygenated blood all over the body system. Because that's what pumps into the lungs, and the lungs oxygenate it. The heart takes it and distributes it. Because after oxygenation in the lungs, the blood still goes back to the heart through another vessel, and they get it distributed to every part of the body system. So your blood is very critical. It's important to ensure that you don't poison the blood, you don't damage the blood, you don't make things that will affect or create a problem in the blood system, that when it gets into those vessels, you begin to create problems. When your blood is filled with fat or have cholesterol, I don't want to jump the gun. You have cholesterol, for instance. Let me give an example. What happens is that you are creating a problem, a barrier within the vessels, that where they are flowing to, where the blood, when they are flowing through the vessel, you are creating a barrier in the blood with cholesterol in the blood. And then when you're going through the vessels, they begin to have this blockage. Cholesterol creates blockage. When it's high cholesterol, let me put it that way, because we need cholesterol in the body system. Appropriate amount of cholesterol, appropriate amount of triglyceride, it's very important in our body system. But when they are in excess, for instance, the cholesterol LDL and HDL has to be in the right proportion. When the healthy level, which they call the bad cholesterol, is higher than the way, it will begin to cause problems. And what suffers it is the blood. The blood, then the next point is the vessel. Then the next one is the heart. There's a clogging, there's problem, the circulation problem, and before you know it, other kinds of diseases that will be mentioned will begin to spring up. After talking about the vessels, the blood, and the heart, we spoke about three things that should come to your mind anytime you hear about the cardiovascular health. And then let's move on to the most common types of cardiovascular diseases. If you're talking about the health of the cardiovascular, there are also diseases associated with the cardiovascular. The three major things, okay? There are things, when you're hearing cardiovascular now, it's not new to us. So there are things, these diseases as well, that can alter the health of this particular system. And the first one that Western medicine has given a name to is coronary artery diseases. Okay, science has done a lot of work to identify some of these things. Research and practice over the years has helped science to categorize this heart disease into different sections. And then, no matter what the heart issue is, all we're talking about here is that they are all cardiovascular health problems. Now, coronary artery disease is defined as the diseases, or it is seen as the diseases or damage in the heart major blood vessels. So when you hear somebody has coronary artery diseases, so you should understand that it's talking about a diseased uh, the large vessels of the cardiovascular. So, and when talking about vessels, like we said earlier, there are different type of vessels in the body system. We have the arteries, we have the veins, we have the capillaries, we have different piping system in the body system, and they are in different sizes and in different shapes as well. The capillaries are the smallest, okay? So each of these vessels, they perform their own unique function. We are not going into that right now. We just want to talk about the diseases for now. So now, the diseases is called coronary artery disease. So you know that it's affecting the large the large vessel of the body system, and that is the artery. Artery is a large vessel. Artery is a large vessel of the cardiovascular. The second one is high blood pressure. Okay, heart disease, high blood pressure. Okay, um, this is a condition in which the force of the blood against the artery walls is too high. Okay, so that's what they called high blood pressure. Ideally, uh, there is a pressure between the heart and the walls of the body of the body cardiovascular. The pressure is meant to be minimal. There will be pressure. So when you say the heart pumps, the heart relaxes. That's what you do, boom, boom. When your heart is pumping the blood and your heart relaxes, it doesn't just pump, 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 pump. There's a resting time. That's what they call the systolic and the diastolic. The systolic and the diastolic. When you are measuring the heart pressure, the pressure of the heart, the top one is the systolic and the downside is the diastolic. So when your heart is pumping, the systolic type, and then when your heart is resting, the diastolic. So there should be a pressure, the amount of pressure that will be exerted by this particular process between the blood and the vessels, the heart, uh, which the arteries of the walls, and the blood itself. So it shouldn't be high. So when it's above the normal range, that's when it's called, oh, you have high blood pressure. And so that means there's something, there's a problem. It could be triggered by anything. A lot of people have different reasons. A lot of people came up with high blood pressure as a result of different things around them. Whatever it is, the major thing is that there is the pressure of your pumping the blood, and the walls, the artery of the blood that takes the blood. There is a pressure between the walls of the artery and the heart itself. So there is a problem there. So it is also regarded as cardiovascular health issues. Now, the next one I want to talk about is, I know people want me to talk about high blood pressure. It's still part of the things we're going to talk about. We're not going to finish coronary heart disease, cardiovascular issues this week. We will continue by the grace of God. Now, cardiac arrest. Cardiac arrest, another one, a sudden, unexpected loss of heart function, the breathing and unconsciousness. This is another one. This one we hear it a lot. Somebody have cardiac arrest, somebody have this and all of that. That's one of the things. There is a loss of function. There is a loss of the heart function and breathing and unconsciousness. May this not be the portion of any one of us by the grace and mercy of God. Because when this happens, when there's the loss of conscious, a lot of people has gone as a result of this particular. Though some have, by the grace of God, have been able to survive it if they get attention on time. So congenital heart disease is another one. When you hear congenital means most like is something, an abnormality that happens before the person is born, or the person that happened before they is born. So when the child is born, the child comes down with such abnormalities. So we have that in cardiovascular as well. Some children, they come down with hole in the heart or certain dysfunction when they are given birth to. And some studies have shown that a higher percentage of these issues as a result of some kind of treatment, drugs, or certain things that their parents took while they were still in the womb. That's why pregnant women are advised, between the first trimester, advised not to take anything indiscriminately. You will work with your doctor, your physician, before you can even take herbs and all that. And that's why I emphasize on this platform. A lot of pregnant women will ask me and said, don't take anything other than the ones that you know, that fruits or vegetables and all of that. Don't anything. Most of the herbs, I usually ask the pregnant women to stay away from some of these herbs. So it is important. So if you're a pregnant woman and you're listening to me now, please take caution if you're in the first or second trimester of your pregnancy. Okay, so it's important to note that. So congenital heart disease is another one that this one, the child comes with a problem of the heart. And I'm also using the opportunity to talk to every woman. Please, in the fertility range line, please prepare your womb very well before eventually before the arrival of the baby. Have so many things in place. There's so many ways you can nurture and build your womb before the arrival of the baby. So congenital heart issue is another problem. The other one that I also want to talk about is cardiomyopathy. Cardiomyopathy is a disease that causes the heart's muscles to grow larger and turn rigid, thick and weak. You know, while we were talking, I made mention of the uh, cardiac muscle that God used in, making or to structure the heart. Now, you can imagine if that particular the heart is now, the muscle is rigid, the muscle is the thick, ever thick, and the muscle is kind of weak. You may imagine, ordinarily it's not supposed to be like that, but certain things just happen. Life happens, and then this issue comes up and they call it cardiomyopathy. So the disease of the heart that makes it to become so thick and rigid and it becomes very weak. That is what is called cardiomyopathy. The other type of health cardiovascular issue is congestive heart failure, and this is regarded as a chronic condition in which the heart doesn't pump blood as well as it should be. So now we have established that one of the process of cardiovascular system is that there's pumping of the blood. Now they're saying that there's a situation that can happen where the heart is not pumping the blood as it's supposed to be, and they have actually termed this as congestive heart failure. Congestive heart failure. So when you hear this, just know that they are saying that the heart is not pumping the blood just as it's supposed to be pumping the blood. Okay, so that's that one. Then the other one that you also know is arrhythmia. Arrhythmia is another cardiovascular issue. What does arrhythmia mean? Arrhythmia means improper, just the way it sounds. It said improper breathing of the heart, whether it is irregular, or it is too fast, or it is too slow. It is expected that the heart should be pumping, the heart should be breathing, sorry, not pumping, the heart should be breathing a certain level. It should be breathing at a particular normal range, normal level. So when your heart is beating too fast, they'll say it's arrhythmia. When it is also beating below, okay, it is arrhythmia. When it is up, the heart is also beginning too slow, okay, irregular. Some is irregular, some is just like it's just too fast, some just it's just irregular. You cannot pin it on saying the heart beats at certain amount, 60 minute 60 beats per second, or 60 beat 50. You can't tag some it will to be 50, so another time to be 70, another time to be 50, 80, 65, and all that. So it is irregular, that's what it is. But if some is just constantly very high, constantly raising, that means it is fast. And if it is constantly just sluggish, that means it is slow. So this beat, this abnormal beating system is what is referred to as arrhythmia. So the next one I'm talking about is peripheral artery disease. Peripheral artery disease. Anytime you hear peripheral, it's actually referred to the extremities, those blood vessels at the lower part of the body system, like the name, or the hand, the palm, and all of that. Those tip of the fingers or tip of the hand, those are what they call extremities. They are the ones at the lower, the peripheral, the outer part, the after part. So these vessels too can get really troubled, where you'll be feeling like there's no proper flow of blood in maybe your palm, your feet, and those parts of your body system. You feel that kind of sluggishness or numbness or sensations or something like that. It means those extremities are not getting proper supplies. The vessels are not getting those proper supply or circulation on that part of the body system. And to tell you, it can happen to anybody, okay, especially certain age. When you're getting to certain age, they advise that you take aspirin, you take certain things. But those things too, they have their own side effects, and that's why we are blessed with abundance of things that can help can help in place of the aspirin. Okay, so we are not talking about that now. We are going to talk about things in nature that God has given to us, that we can eat in our food, that can help us to achieve these aspects. The next one I'll be talking about today is stroke. The stroke is another problem of the cardiovascular. So when you see anybody who has stroke, you know that it's around the heart, the vessels, and the blood, and that's part of the cardiovascular system. So it's a cardiovascular health problem. So when a stroke happens, it is damage to the brain. Stroke is usually to the brain from there's an interference in the supply of blood supply. There's an interference of blood supply. So if there's no adequate, there's a problem. There's a stoppage. There's a blockage. There's something that causes the brain to get the supply. You see somebody just come down with a stroke, maybe on the left side or on the right side, and all of that. And before you know what is happening, the person just collapses and all of that. So most time when the stroke is on the right side, it usually affects the speech of the people. Okay, it usually affects the speech. Most times, if you go and ask, most people who have stroke on the right side usually affects their speech. And then the stroke on the left side is usually the very devastating one because it's close to the heart. That's why people say when it's on the left side, most time people die. I know you know there are two different types of stroke as well. There's ischemic stroke, there's hemorrhage stroke as well. But we're not talking about stroke today. We are only categorizing different kind of health, cardiovascular health issues. Another type that we want to also talk about is congenital. They call some congenital heart disease. Another adds so many other issues of the heart. There's also the heart infection. Okay, there's also valve disease. The valve of the heart may also be diseased. There's also that part as well. There's also infection of the heart. The heart can also be infected. The heart can also infection can also transport to the heart as well, because when we have infection, that's why they usually advise that when you have infection, quickly treat the infection, or make sure you also prevent the occurrence of infection. It's really hard, but it's possible. Prevent it, so that because it affects the blood, it gets into the blood. When they want to do a test for you, they either do urine test, blood test, and all that. When they do your blood work, they can see that there's an infection there, especially when the lymphocyte is on a very high level. That means that the white blood cells is rushing to the particular center where there's an infection to invade the place, to make sure that the infection doesn't have a damaging effect to your body system, and they see it. So all this infection, if they stay in the body for a very period of time, they can transfer, because the blood goes everywhere. It can get into the kidney, it can cause kidney cyst, it can get to the ovary, can get into the liver, it can get into the all kinds of places, and it can also transport to the heart. And then the infection, is also affecting the heart, affecting every part, because the blood flows to every part of the body. The same thing with diabetics as well. If you have diabetes, there's a connection between diabetes and heart issues. I'm not going to be sharing that today, but there's a connection between the diabetes and also the heart issues, because it's also about the blood, the vessels, and the heart. Because when there's so much sugar, there's what they call glycated red blood cells. The blood cells, the sugar, the red blood cells are usually attracted to sugar, and on a daily basis, when we take blood sugar, and when we take sugar, glucose, high glucose food or carbohydrate food, and we have enough glucose in our body, which is important for energy level, for production of ATP in the cells. But then over too much of it, that's why it is not good, because this blood are attracted to blood sugar, and that's why they do HbA1c test. When you do HbA1c test, they're trying to ascertain the amount of sugar, glycated, the amount of sugar that's attached to your red blood cells. And gracefully, God has made it so in such a way that the red blood cells dies every 120 days. Your blood cells, your red blood cells, once it's 120 days, it dies off, and another one is produced as well from the bone marrow. Now, if you keep having stop of blood sugar, so the amount of blood sugar that you have in your blood determines the amount of attraction that you have on the red blood cells. So if you have large amount, you keep having large, the more new ones are produced, the more they are attracted to the sugar. So when you keep having that, this blood can get transported, it will be transported to other parts of the bodies too. And what happens? They begin to cause damage. This sugar begin to cause damage. And when the blood is glycated with sugar, what happens? It thickens when it passes through the vessels, it can thicken the wall of the vessel, and that's why they usually have high blood pressure. That might be the onset of their high blood pressure, and also it also causes a blockage, and it can cause heart issues. It can, and that's why diabetic patients too are always being checked to for their lipid, for their blood, for their to regulate their blood sugar so that it doesn't go and affect their arteries and cause a blood clot, and also affect them and cause them to have a stroke. So it's a complicated issue, honestly. That's why anyone who have blood diabetes should ensure that they control their diabetes, and they ensure that they get out of their diabetes system as fast as possible. It is possible, it's happening. People are getting off their diabetes history, and they are recovering very well. So if you are in this category, I trust God for you to be also able to get hold of this. And please, I want to encourage you, while you are doing that, ensure that you get your blood sugar controlled, whichever way you want to do it, with your medications. And when your blood sugar level drops below 100, then you begin to work on other parts of your body system. As I round up tonight, let me just quickly touch on some of the symptoms of cardiovascular health issues. Okay, the first one is vomiting. They can be vomiting prior to issue an attack of the cardiovascular health problems. It can just be profuse vomiting and all of that. Please, I also want to make a caution here. Some of the symptoms I'm talking about here, they are also symptoms of other issues, especially for us women here. I like to emphasize on this. Many of these symptoms, all of the symptoms are also symptoms that are also related to menopausal issues, premenopause or menopausal issues. Okay, so if you by chance notice that you have any of the symptoms, it's just good to talk about it. We can't shy away from here, like I said, like people say they don't want to hear, they don't want to hear. It is better for us to hear. Some will say, oh, they get anxious, they get when they start hearing things like this. Also feel, see, I can feel that way too sometimes, but we need to train our mind to just get to understand why some things are happening, the truth about certain things, so that we can get ourselves, we can be informed. Okay, we can be informed, well informed. Information is powerful. We can't write it off that it is not important. So some of these symptoms, please, they may not be heart issues. It may just be a sign of premenopause or menopausal issues and like that. So the first one, like I said, vomiting. The next one is nausea. It could also be back pain. You're having frequent back pain. Cold sweat. Some people just have sudden cold sweat, and that's also a menopausal symptoms as well. So that's why sometimes they said women don't know that they're having cardiovascular issues, because it disguises as premenopause or menopausal issues. So if you're having this, you may also want to do a regular checkup of your heart condition and all of that. Just do your cardio, do your ECG, cardio and all that. The doctor will tell you the kind of test that you should run to check the state of your heart. Like we said, it is also good to do a return check on a yearly basis and all of that. And if you think that you are doing well enough, exercising, eating healthy and all of that, and well enough, so you can also do it every 2 years. But it's good to do your regular body checkup. And also paleness. Also another one is paleness. Some people can just be looking pale and all of that. Then dizziness. You can see this is dizziness could also be a sign of shortage of blood. PCV drop and all of that could also be part of it. So it may not necessarily be an heart issue. Then it will also be shortness of breath. Shortness of the breast, so tightening of the chest too is another one. So if you're having a combination alongside with tightness of chest, shortness of breath, sweating and fatigue, muscle weakness and all of that on a regular basis, I think it's one to go and check up your cardiovascular health. And also maybe your blood pressure, your irregular heartbeat, palpitation over palpitation. Palpitation is not only about heart problems alone. It also comes with menopausal issues as well. If you have a menopause, you're getting to menopause. Depending on age, of course, menopause starts from the beginning of maybe like 45 to like 55. So if you have that, it may also be a sign of menopause, and it also be a part of. But if you're having regular something close to the heart region, please do well to check with your doctor as well. So please don't get scared. Cardiovascular is a very interesting topic. We'll do a lot more. We looked at what are the options. Are we left? We are not left helpless. We are not helpless. I don't hear you say, oh, this cardiovascular, my heart let you not fail. No, there are other things. The same thing that you're doing for healthy living lifestyle is the same thing that takes care of the health. That's the amazing part. That's the beautiful part of it. The heart is easy to take care of. The vessels are to be clean. We'll talk about that. Don't let us jump the gun. You will have an interesting class next week by the grace of God. So on this note, I'd like to close the class for tonight. I look forward to hearing your questions, and also working on different things that we've talked about here. And then I look forward to seeing you next week, where we'll be talking deeply about our cardiovascular health and some of the food, the herbs, and the things that we can take alongside to help us in our health. Thank you for listening, and have a wonderful, wonderful time.